Welcome to Life with Shenita. My name is Bernard. I'm accompanied by Charlie. We have some other guests who will be coming on very shortly. But we just wanted to have a discussion about African American men and our health. We want it to be an open discussion, very direct, because there's so much information and misinformation concerning the health of African American men that a lot of that needs to be addressed and talked to. We all face challenges in life. That's just the way it is. And we also hear quite often about prostate cancer amongst African American men. And that's the main thing we want to talk about. But we also want to focus on your health because the more healthy you are, the better you are able to handle challenges such as if you have prostate cancer or some other type of disease. It's easier to prevent disease than it is to treat disease. And if you approach it that way, there are some lifestyle changes that are within your power to change. And there are some things you can do to make it more difficult for any outside invaders, whether they be cancer or COVID and those types of things, to totally take you down. Because we want you to be there for yourself, we want you to be there for your family, and we want you to be there for your extended family. We have to be the anchor that holds that ship in place no matter how rough the waters may get. So I'm going to turn it over to Charlie. He can tell you about his experiences and we'll go from there. So here's Charlie.
Good evening. Uh, I'm no stranger to Life with Shenita, or I'm no stranger to this topic. This is about maybe the third time that we men have been on to discuss issues relating to black men and our health. But I'll tell you a little about myself. I am 74 years old,
Good for
and
you.
as far as health issues was concerned, uh, I've always, throughout my life, had health issues. But in 2019, I was diagnosed with prostate cancer. However, one of the I say the good things, or I say I was blessed because they got it very early. And one of the reasons that they got it early is I was having yearly checkups, and it was during one of the yearly checkups. Again, when they were checking my PSA level, they noticed that it was rising, and then it reached a level that they said, yes, we need to do a biopsy. So they did a biopsy, and it was cancerous, but again, at one of the very early stages. So as a result of that, I had to have uh, only 3 months of radiation treatment starting in 2020, January, February, March of 2020. And after the radiation treatment has been over, I've had several checkups. And in fact, within the last month, I had a checkup and my PSA level was extremely low. And my doctor said, as far as the prostate cancer is concerned, at this point, I am in remission. I do not have
Good to
any
hear.
cancer. And again, a lot of that has to do with getting diagnosed early. Now, with that being said, is in 2021, I was having another yearly checkup. I have reflux, so they were doing a CAT scan, and when they did the CAT scan, they discovered that I had a lump in my left breast. Uh, they then did a biopsy, where I had to have a mammogram and had a biopsy, and it came back that I had breast cancer. But again, because of a yearly checkup and finding it very early, again, I did not have to have chemotherapy. I did have to have a mastectomy, and Again, 3 months of radiation treatment. Uh, in fact, I had an appointment today with my oncology specialist, and he said at this point, there's no detectable cancer, and uh, for all practical purposes, I am again in remission. But the key thing I want to keep saying, and I know I've said it tonight at least 2 or 3 times, early detection and men going in and having yearly checkups is that, you know, Bernard and I were talking about this before we started tonight, is for a lot of men that they know that they have things that's wrong with them, but because we are, I'd say, afraid to admit that we are afraid, we don't want to know or to go and get verified that something may be wrong with us. And so we skip appointments, we don't make appointments, we make our wives have to nag us to go in and get appointments. It shouldn't have to be that hard or that difficult. Is go in, get your checkups, keep check of how you feel. Your body tells you most time when things are not going right. So we know if something is out of order or we're not feeling the way we should. Go get it checked out. Early detection. And I'll be coming back and forth to tell about some additional things associated with my two cancer thing. But right now, I go back, Bernard.
Thank you. That's great news to hear. And the key thing you mentioned was early detection. So you'd better find something out early. You have more options on how to treat it versus if you wait, your options are limited. And that's in so many aspects of health. Well, let's talk about how do you prevent cancer? Not just prostate cancer, but cancer across the whole body. Number one, the better your overall health is, the more likely your own body's immune system can fight back against that cancer. Now, we all know the basics. You know, you're supposed to eat right, plenty of rest, low stress, high fiber diet, really basic stuff. And again, whenever we go get something to eat, we have a choice to make. You know, I like all the bad things. You know, I like barbecue, I like red meat, all that stuff, but I don't eat it because at my age, over 65, I know if I want to enjoy the years I have left, I'm going to have to make some decisions to keep me healthy so I can enjoy the years that are left. Now, when you look at, I had a gentleman ask me, well, okay, you're saying I should eat a high fiber diet. You know, what should I eat? Now, you can go online and just Google high fiber diet. You're going to find thousands of high fiber diets. But real basic, focus on leafy green vegetables, collard greens. Now, collard greens, you got to watch out how you season them because the seasoning can be worse than anything else. Kale, when you look at spinach, when you look at all those leafy greens, they are healthy. They're reasonably high in fiber, and they're good sources of magnesium. And magnesium is a mineral that, as we get older, we tend not to produce or we tend not to get exposed to as much of. And magnesium plays a part in almost all of the cellular activities through your whole body. So green leafy vegetables are one, and also drinking water. You know, it's been well known in places around the world that have longevity is when you get up in the morning, the first thing people who live to be 100 plus, they drink a glass of water. They don't eat anything for at least an hour, but they drink a glass of water. Because what that does, it helps your kidneys to help filter out the toxins it's been working with all night long while you were sleeping. It helps your liver to help detoxify itself to get all of those toxins out of your body again. So if you, when you get up in the morning, this is easy to do. Just drink a glass of water before you eat anything, before you eat anything else. Now, when you talk about breakfast, and I just read an article recently where a doctor was talking about you shouldn't skip breakfast, which I happen to agree with. But what's also important is what you eat for breakfast. Sugary cereals are usually not the best choice. Sugary cereals, and I like them too, are usually not the best choice. So you want to be discriminating in what you put in your body because the body has a very strong ability to heal itself if you give it the right environment to do that in. Let's talk about stress. Now, a lot of times, stress is just a part of human existence. If you're working a job, you got mouths to feed, you may hate your environment, you may hate your boss, but you got to stay there to make that money, take care of the mouths you have to feed. I understand that. But one of the things you want to get into to reduce stress is exercise, just walking. Right now, example, I walk, get up early in the morning at 5 o'clock before it gets hot outside, and it takes about 2 hours, but I walk 6 miles every other day. Took me a while to get up to that point now, I'll admit that. But that makes me feel refreshed. It's good for my heart, and it's overall good for my immune system. Now, and you all may have heard this too. I know I'm kind of skipping around a little bit here, but you may have heard of the term gut biome, which means what happens in your gut impacts almost everything else in your body. So if your gut microbiome is not in a good situation, it's going to affect your mood. It's going to affect your ability to be regular, okay? And can it also affect your ability to stave off diseases? So keep in mind that when you eat a high fiber diet, and I tell people become label readers. When you look at something and two choices to eat something, usually choose the one that has most fiber because those little choices that you make can have a cumulative effect on your overall health. And number two, I think Charlie had mentioned about there's been an increase or uptick in colorectal cancer. And again, colorectal cancer becoming more and more common, particularly in the African American community. One of the ways that you can help, your colon is to eat a high fiber diet and be regular and drink plenty of fluids because that helps everything move right on through. One of the things if somebody says they have a bowel movement once a week, that's usually not good. So there are other folks who have a bowel movement every day. That's usually pretty good unless it's, diarrhea, which we won't talk about that. But you have to take control of your health. That's all you got. When it's all said and done, you can have all the money in the world, live in the biggest house on the street, but if you are miserable, how happy can you be? And when you are faced with a health challenge, and again, they can happen to anybody, anytime. If you've done all these things and your body is strong, that particular health challenge may be one you can deal with better because you've addressed the comorbidities, hypertension. And Charlie and I were talking about obesity, which is becoming an issue. Well, it's always been an issue, but now it's getting more attention. And specifically, if you are obese and you develop prostate cancer, you will develop a more aggressive type of prostate cancer if you're obese, meaning that it's more likely to spread across your whole body. And if it metastasizes to your whole body, it's a whole nother ball game in how to treat it and how many years you're expected to live. So that's an additional incentive to watch your weight. I used to tell gentlemen, I said, look, if you look down and you can't see your junk because of your belly, you got some work to do. That's just can't sugarcoat it. You got to do that. It's not hard. Now, we're not asking you to do cold turkey. We're not asking you to change everything overnight, but little decisions that you can make. When you get up in the morning, drink a tall glass of water before you eat anything. At least wait an hour. Number two, try to work in exercise in your day-to-day process. I mean, people have trackers, whatever it may take, but studies have shown if you have a job or you're sitting down in a chair for long periods of time, that's not healthy. Number three, and here's something interesting. I read a study that said that if you implement a thorough stretching regimen, you're just stretching your arms, your legs, your major arteries, in a lot of cases, that's just as effective as blood pressure meds. Now, it's not across the board because you may have let things go to the point where you need very strong blood pressure medications. However, wouldn't it be nice to know that if you just stretched significantly, let's say every other day for at least a month, that it can reduce your blood pressure without making any other changes? Think about that. And also, there's the issue of talk about obesity, exercise, rest, and let's talk about red meat. I like red meat. I ain't gonna lie to you, but I don't eat red meat because again, all the studies that I have seen have said high red meat intake usually results in a higher rate of cancer. There was a doctor in Germany back, oh God, maybe 30, 40 years ago that proved through specific studies that a diet that has a high red meat percentage compared to all the other things these people would eat had a higher percentage of cancer than a diet with a lower percentage of red meat. So, we were brought up the main course of your meal is meat. Then you had a little bit of this on the side, and a little bit of that on the side, and a little bit on the side, and then some dessert. Well, we need to flip the script. The meat should not be the biggest portion of your meals, and it should not be the biggest contributor calorie wise. And you can work in, some vegetables. Like I said, if you season them right, yeah, they taste pretty good. Now you're gonna have to get your taste buds; they're a little spoiled, but you can adjust, and they will. But you will live longer. You will have more energy. All your parts will work. It's just the best place to be. So I'm gonna turn it back over to Charlie and see if he can add to that.
All right. Uh, Good information. And if you're watching and you know some other men that you might think need, get, then get them involved in this conversation also, because that's the most important thing is just getting the information out. And as Bernard has said, the different things that he related, it all goes back to we have to take control of our own health. And it starts in our own mind. Our own mindset is that uh, eat what we eat. Most of the time, we know what we are eating is bad for us, but we continue to do it because, well, I've always eaten this. This is soul food. This is what we grew up on. And so we make excuses. But if it's affecting our health, then only we can make that change. We have to decide, okay, do I want to keep doing something that I know is detrimental, or do I make some changes? Yes, uh, as Bernard said, some of the things we like or want to do is good, tastes good to us. And so it might take time, and we know that. And we're not saying tomorrow, if you're eating red meat, just stop completely, because we know that that's probably going to be unrealistic. But at least come up with a plan. What can you do starting early? Bernard mentioned about drinking a glass of water first thing every morning. That's something all of us can do. If you don't have a glass of water, get before you go to bed. In fact, because this is what I do, is I put a bottle of water on the dresser right next to the bed. So when I get up in the morning, first thing I do, drink some water, because I also read that how beneficial that is. So again, start in the mind. We have to uh, get it in our own mind that this is for me and nobody else. We can go to the doctors or whatever, and they can give us pills or they can make us feel good for a while. But for our long term, we have to do the work. We have to do it. And I see that Wendell has joined us. So, Wendell, come on in.
Take it away, Wendell.
Don't know, Bernard. I don't know where we're at.
Well, just generally, we were talking about health and some of the things that you can do to improve your health: diet, exercise, reducing stress. We talked about, the higher prevalence of colorectal cancer, and that a high fiber diet will assist you there. We got a little bit into the fact that as African American men, we're expected to be strong, and that's nothing wrong with that. We got no problem taking on our shoulders. But, and I think Charlie really emphasized it, that even though you don't want to hear bad news, it's better to hear it and have some options than to hear it and say you have no options. You got 6 months to live. So that's where we are.
Okay, yeah, and I agree with what Charlie said. It's important for people to get checked. One of the funny, not funny things that I've heard from more than one man concerns prostate cancer. Well, man, I want to go there because that affects what they're calling their manhood, right? And I'm like, look, if you get prostate cancer, it's in the late stages and you die, your man is going to be seriously affected. But if you start early, they've got so many things out here now that treating an erectile dysfunction is very, very positive and has a very positive outcome. So I encourage men to go there and get checked. There's nothing wrong with, even if it never works out again, you should not define yourself by what's between your legs. It should be by what's between your head.
Hmm. I agree. I agree.
Totally agree.
It's kind of an interest. Oh, go ahead. I'm sorry.
No, go ahead. Go ahead, Bernard.
No, I was going to say, a lot of guys say, well, I don't know about that DRE. I said, oh, you mean the digital rectal exam? He says, yeah. I said, well, let me give you the choice here. Would you rather have that done and catch something early, or would you rather get the bad news that you've got stage 4 and it's already metastasized across your whole body and you got 6 months to live? So think about that choice when you have a hesitation about that. And it ain't that big of a deal. It's less than 1 minute.
It really isn't. And the lubricant they use, no matter how big the doctor's hands is, it'll close back up.
That's right. Good point.
So we've got to. It's been a catch 22 today. We're talking about men's health today. I've been trying for 45 minutes to get on.
Oh,
And I
sorry to hear that.
purposely said, I'm not a hypocrite. I'm just going to get on when I can. I'm going to work everything possible to get on. And I'm glad to be here. Now my phone is notifying me that I'm 10% battery low. So, Bernard,
Oh,
you may have to take over again because my charger's in the car.
oh, okay.
I expect to use my laptop. Though we're
Okay.
still good. But one thing I want to say about that, and it ties into what I just said. Thank you, Bernard. Thank you, Charlie, for getting on. Dr. Bridges is still trying to get on. We've had issues. And this is one of the key things about men's health. We've got to talk.
Mhm.
We've got to communicate. We got to tell people, hey, I got issues. All right. And Bernard jumped in. Same thing with this. Look, man, I've got issues. I've had issues with prostate cancer. I've had mental health issues, right? And I talk about it openly and honestly. Charlie, I don't know if you talked about it yet, but I know Charlie was willing to talk about his issue with breast cancer. And yes, men do get breast cancer. So we need to talk about these issues and not what I call the barbershop medical advice while you're getting your hair cut. For somebody sounds knowledgeable, but absolutely has no clue what's going on.
Good point.
You're absolutely.
So, okay.
Uh,
Yeah. So what I'm going to do now, Bernard, if you could continue on, I'm going to go to my car and get my charger, and I'll be
Gotcha.
back. I'm going to drop off right now.
Okay. All right. Appreciate it.
Thank you. And Bernard, I sent you a list of questions in text and also an email.
Okay. All right. Awesome.
And I'll shoot you a screenshot of some men's health statistics too before my phone dies.
Okay. Awesome. I'm gonna look those up.
Thanks.
You were saying, Charlie?
uh, Wendell was talking about my bout with breast cancer, and yes, when I found out that there was a lump in my breast, is that, yeah, I'm not saying that some thoughts didn't go through my head, because like we tend to think, well, men don't get breast cancer, but yes, yes, we do. It may not be a large percent, and we do. And so we do need to talk about it and think, because when I was diagnosed, uh, I felt cut off or alone, because I said, well, who can I talk to? There's no other man that I know of who may that has gone through this. So what do I do? And in fact, in my mind too, is that initially, instead of saying breast cancer, I was talking to my wife and saying chest cancer, because again, the way I was perceiving it, and well, how do I talk about this? And when people ask what's going on, what do I say? But then I had to again realize what I had said earlier about it starts in our own mind. Is
Mhm.
that I had to get is that, yes, this is something you are going through. And I can sit back and have all these issues or questions in my mind, or I can do something about it. Yes, I can read, but I wanted to have uh, some person to person contact information. So I contacted a woman that I knew who had recently gone through breast cancer. And she became my advocate. She walked me through some of the things I could expect or whatever. So, and I'm saying this is that no matter what kind of cancer or what issue you may be going through, you are fighting really two battles, one physical and one mental. And I'm not sure which one sometimes can be the worst. So, again, we as men have been taught we are strong. We're not supposed to be weak, and we are supposed to be able to take anything and everything without asking for help. That's one of the worst things you can do is go through any kind of major illness, cancer, or heart attack, or whatever, trying to do it on your own. We need, as Bernard had said earlier, we men, we need to talk. We need to open up and be honest about what we're feeling and what's going on. Because going through at this stage two specific cancers is that I could not have made it through, first of all, without God, my wife, and family, and the support of, again, other men who had gone through the prostate cancer, and my advocate, who uh, was just like an angel helping me get through.
That's awesome.
Uh,
That is awesome. Well, I've got the questions that Wendell had left with us, just some information, some background information. I'm just going to read it really briefly here. Health status is from Men's Health. It says percent of men aged 18 and over in poor or fair health, 13.2% as of 2020. Talks about percent of men age 18 and over who meet the 2008 Federal Physical Activity Guidelines for aerobic activity, leisure time aerobic activities, exercise, and only 57%. So a lot of us are not engaging in any appreciable amount of physical activity. Obesity, percentage of men age 20 and over with obesity, 40.5%. Think about that. Almost half of all men are considered to be obese. And talks about percent of men age 20 and over with hypertension, and that's 51%. So about half of all men have hypertension. And you heard it before, hypertension, high blood pressure is the silent killer. It's something that can creep up on you. And unfortunately, a lot of African Americans have hypertension. They've tried to determine why that's the way. I mean, there have been some theories about during the slave days, we had to work in the fields and would not let go to get any water. So we had to train our bodies to hold in all of the fluid. So again, genetic traits, really, it's surprising how quickly they are passed to the next generation. So hypertension is something that if you have it, you need to address it. You can get right now you can buy a arm cuff, which is one of the most reliable hypertension measuring devices versus the ones that fit across your wrist, which are all right, but not as reliable as the arm cuff. And just check it out. And it's very easy to find statistics on it and talk to your healthcare provider, because if it's really, really high, obviously the first thing they're going to say is we need to get it down quickly, and that's going to take some pharmaceutical drugs to do that. But even if that's the case, then it goes back to those choices. You can make lifestyle choices. Let's talk about high fiber, low fat meat eating. And here's one thing that people don't realize. People used to think for the longest time the main reason why you would get heart disease was cholesterol. Now they have found out the main reason why people have heart disease is sugar. Think about that, sugar, because sugar hardens your arteries. So when you have to go under stress, your arteries can't expand, and that's when you have an increased likelihood of stroke or a myocardial infarction, which is a heart attack. So think about your sugar intake. We're talking about processed sugars. I like donuts, I like cake, I like all that stuff, but I eat it as a little as I can because I know the long-term effect. So, and stress also impacts that too. Oh, here's Wendell back again. I'm going to turn it back over to him. I read the three questions you had highlighted in yellow, but I didn't get to the second page. So, limitless
And
hope.
Okay, not a problem. Thank you, Bernard. I really
Okay.
appreciate that. Is the last one you talked about the hypertension one?
Hmm. Yeah, I
Okay,
just talked. Yeah,
okay. I'd like to elaborate a little bit on that. As you both know, and Bernard, what I'd like you to talk about just briefly now is they call hypertension the silent killer. Why is that?
because it could be symptomless. You may not have any symptoms. You could be having high blood pressure. You don't have a headache. You feel all right. You don't know, but it is destroying your circulatory system. And if you don't treat it for a long, long time, some of those small vessels that, you know, impact your manhood, they could be damaged to the point that you can't get it back just because you didn't want to have at least have an annual checkup and see what's going on. So it's critically important for a lot of different ways. Your heart, your overall circulatory system, everything is impacted by hypertension. I'll go back over to
Yeah,
Charlie.
yeah. Charlie, is there anything you'd like to add, sir?
No, just again, keep saying it over and over. Get checked. Go in and get your checkup. That way, or they have you in an order from Amazon, Walmart, or whatever. Get you your own uh,
Blood pressure cuff.
to take your own blood pressure so you can keep up with it.
Thank you very much. And one thing about the blood pressure cuff, get you a quality blood
Mhm.
Oh
pressure
yeah,
cuff.
that's true too.
All right. Don't get one that comes like Cracker Jacks with a prize inside. Get one that works very well. You know,
Good
get one that
advice.
works because it's critically important. And there's so many things that you can cut back on. We as African Americans, I call Black Americans, one thing that really affects our blood pressure is salt.
Mhm.
And there's salt in so many things that I absolutely enjoy. But if it's a choice between cutting back on what I enjoy and living, I'm going to live.
Mhm.
So we need to do that to live. And check this out. All of you men out there who think you can't live without fried chicken, fried and lard with a lot of salt and pepper on it, you actually can.
Yeah,
And
you
you will live longer and you will live a better life. Your taste buds will adjust.
can. So true.
You know, so
So
many
true.
times people put salt on their food before they even taste their food. They're just tasting salt.
Hmm.
So you don't even know what your food tastes like already. So why not try, change up, and take care of your health?
Hmm.
But one thing I really want to touch on, one thing that's important to me, is I want to ask Charlie, if y'all have not talked about it yet, I'd like Charlie to talk more about breast cancer in men. Because
Yeah.
that's a subject, a lot of men don't know about. See, the reverse is not true. Men can get breast cancer, but women cannot get prostate cancer.
Very true. Good
So,
point. Good
Charlie, let's
point.
eliminate the stigma of breast cancer in men, please.
Yeah, and I did talk about it somewhat before how you were out, but again, to just reemphasize what I was one of the key points is that, and as you said, is yes, men can get breast cancer, and I had gone through some of the things is that we we stigmatize things because I was saying is initially was diagnosed uh, with cancer, breast cancer, and talking to my wife and thinking about chest cancer. As far as saying, and even when I was going for radiation treatment and things, is that uh, when I would go in and had to take my shirt and everything out, the ladies, because there was mainly ladies there, would uh, have to say, "Well, we're sorry. We don't. We only have pink things that you can put on. If so, what? Give it. Just put on. It doesn't matter because what's the key thing is okay. I am being treated for it,
Right.
and I said because they found it early, and I
Yes.
know this, but it bears repeating to keep saying is that again as men we have to stop relying on our wives to make our medical appointments for us or to nag us into having to go in to get our appointments and things. Is that again with both cancers that I had? I know some people might say I was lucky. No, I was blessed, but
Hmm.
it was because I was doing the things that I needed to do
Right.
and going in and being checked. But yes, men do have breast cancer, and one of the things that I was talking about also is going through rather than just being a man thinking I can go through this with myself or my wife or my immediate family. I reached out to a woman who was also or had been going through cancer. And that thing that again we men have to do and get out. We cannot, well, yes, we can. We can carry the burden of the world on our shoulders. And that is one of the reasons we as black men tend to die quicker than almost any other group. So if you want to be that strong and think you can carry, get through things by yourself, just keep trying to carry the world, keep living with the stress. And this doesn't have to do with breast cancer, but in a few days we are going to be going through the 4th of July, and just in our mind, let's think of the menu that we can't wait to start eating. All the ribs and the barbecue and the desserts and everything. Is that, and I'm not going to think that we are going to be uh, what we talk about tonight is going to make you stop doing it, but at least think about what you are going eating and putting in your body on the 4th of July. Uh,
Yeah. Thank you,
There you
Charlie.
go.
Bernard, you want to touch a little bit on breast cancer and the stigma in men, please?
Yeah, it's important to know that again, breast cancer can happen to anyone, and any health challenge you're going through, one of the ways you get through it is to if you have some support from
Yes.
family members, other gentlemen. So breast cancer, again, in men, we're not going to be, and you can't see it in a woman either unless you're doing the mammogram. So not that you walk around and somebody can look at you and say, oh my God, you got breast cancer. They can't say that.
mhm.
So, but it's important to know if it's diagnosed, treat it. I think Charlie has been an excellent example in saying
Yes.
if you get it, determine you have it diagnosed early, you have options. When you don't do that, you don't have very many options. And one of the options is you'll die. Just got to tell it
Yes.
like it is.
Yes.
So in healthcare, my background is I used to be a spine specialist for Medtronic,
Hmm.
and I'd be in the operating room and I have the scrubs on. Okay, I don't touch anything now, so don't worry about people like me who are not MDs. But one of the things that when people would ask me, my back hurts, my lower back hurts, it's sore. And I say, okay, now if you get to the point where your over the counter medications are not working anymore, you go to a doctor, and here's the first thing you want that doctor to do is take away your pain. You are not worried about what's causing it. You're not worried about what's going to happen 6 months down the road. You go to that doctor for one reason: take away my pain so I can go back and do what I've been doing, whatever it might
Hmm.
be. The doctor knows that. So he prescribes painkillers. He may give a little overview about, okay. Now, what you don't know, this is because I know about spine because I was a spine specialist,
Hmm.
is that there's a reason why you hurt. And if you don't address the reason why you hurt, guess what? It's going to get worse and worse. And then you're going to come back for more stronger painkillers. But all that time, your back and whatever's causing that pain is getting worse to the point that you have limited options.
Hmm.
The doctor knows that. But guess what? It is in his economic interest not to emphasize
Hmm.
that, okay? Because if you did the physical therapy they may or may not prescribe, if you did the right things as far as getting up out of that chair at least once an hour, you wouldn't need surgery. But
Hmm.
you don't know that. So it's in their economic interest to say, okay, come in, let me give you a more powerful painkiller. You're like, okay, he's a doctor, she's a doctor, I got more powerful painkiller. So again, and it degenerates to the point where you have very few options or one option, which is a spinal fusion. And I just read another article, and I was back in spine specialist back in the mid 90s. Here we are in 2022, and only 50% of the spinal fusion cases work.
Hmm.
However, Once you have a spinal fusion, you are now a lifetime patient. The
Mm,
question will not be, are you coming back? The only question is when. But see, if
hmm
you take it back, you first came in with pain, they gave you a painkiller, you were like, okay, everything's fine. I don't hurt anymore. I can go ahead and drive my truck or work at my wherever I'm working. Not realizing that that condition is degenerating, degenerating, degenerating. So just be aware. Like I think it was mentioned earlier by Charlie. You know your body. It
Yes.
lets you know
Yes.
something's not right. Something's not right. So just killing the pain, okay, short term might allow you to get out of the bed, okay. But long term, you're probably not going to have a very good outcome because whatever is hurting is going to get worse and
Yes.
worse and worse. All you're doing is covering it up. So I'll
Yeah.
give it back to
Yeah. I agree 100%. And another thing that you touched about pain, right? And I want to emphasize this to all the men in the audience. Even if you go to the doctor and the doctor prescribes pain medication and the pain goes away, but he still wants you to do physical therapy. He still wants you to do this. He still wants you to do that. Hey, I'm good. The pain's gone away. No, your body is still healing. If you have surgery for prostate cancer, it takes a year for you to heal. Yes, you feel better, but your body's still healing. So do what he told you to do. Do the Kegel exercises. Do the things that you need to do. Just because you feel well on the outside does not mean that you're healed on the inside. You've got to self responsibility, men, for your role after you leave the doctor. Or, as Bernard said, it's not a matter if, it's a matter of when, and it could be prevented. So
you.
if you're one of those who once you feel better, you're not following the doctor's orders, when you go back to the doctor, look in the mirror and you find out why. That's
Hmm.
not a criticism. I'm trying to encourage you to do the things that you need to do as men to take care of your health. Okay. And I want to share this. One thing is that Shenita's husband, Winston, 7 years ago, he had a heart attack and now he left prematurely. So it's important for us to do things that we can do to prevent it, right? I mean, we're all going to die of something, right? But it's one thing watching the train and another one jumping in front of it and saying, hit me, hit me.
Hmm.
Don't jump in front of the train, man, with your health. And another thing, when I think about health, or most men think about health, we think about physical health, right? You all may remember there was a basketball player a couple of years ago who fell to the point where his leg broke and his bone was sticking out of his leg. Everybody has sympathy for him. But when your mind breaks, some
Hmm.
people run like roaches when you turn on the light. So you need that support, that mental support, just as you do the physical support. So I'll share a quick personal story. At 18 years old, I had a mental breakdown. And at that time, it was the worst thing that happened to me. But now at 64, it's one of the best. Why? Because it got me studying neuroscience. It got me studying the brain. It helped me understand when they say you only use less than 10% of your brain, a lot of the other things that it's left for. And I want to encourage men. My phone number is 404-455-2610. 404-455-2610. Call me. That's my personal cell phone number. You got issues, especially about prostate cancer, mental health. I'll share with you what I went through. And but probably at the end of our conversation, you'll be laughing, but you'll get the point. So these gentlemen here, I don't know if they mentioned or not, but the trio of us and Dr. Bridges, we did two other shows of Life with Shanita focusing on prostate cancer. We had a lot of fun, but we got the job done. We got the point across. And you can Google Life with Shanita, look at her shows, and find out those on prostate cancer. And there's a lot of other great things, men, that aren't just geared toward men's health, but people that you care about health, relationships, women's issues. We need to be informed so that we can be whole people. And speaking of mental health, it's not a physical or mental, it's a combination because some physical health issues are created by mental. Either one of you men want to talk about a little bit more how some physical issues are created by mental issues?
When I step in first, Charlie, I have a little bit more in a different area. But I'll let you go first.
All right. I mentioned earlier about uh, when you have a physical, this won't directly answer your question, but to go back to the point of when you are going through something physical, you are really going through two sort of dynamic illnesses. You have the physical that you're going through, but also that mental thing that you are also going through is that the stress, the your thoughts, you, that in many cases can make the physical worse because as we go through things and then our mind is thinking about, oh, I have cancer. What if I die? Who's going to do? And all those kind of things. And especially at night or whatever, while you're trying to sleep and things that you think you are controlling or but you are not. That stress, again, the mental thing can lead to worse physical thing. And
Mhm.
like you were saying, is when you're going through something, we need to reach out to each other. We need
Yes.
to find someone to talk to uh, with our mental health issues. And again, this is another place where we as men think, "Oh, I'm macho. I can take care of these problems or issues," but it does not hurt. Well, and in fact, it's been shown to help when you talk about what's going on with yourself, because that
Yes.
relieves a lot of the pressure from
Yes.
inside your body and gives you more energy and thing to deal with whatever physical issue that you're going through.
That's true. Bernard?
Yeah, a positive attitude impacts your overall health. And it's been shown that those who have a positive attitude are healthier and live
Yes.
longer. So whenever a negative thought comes to your mind, you have the power to say, I'm not going to think that negative thought. I'm going to think the positive aspect of it. And believe me, those little decisions, step by
Yes.
step, can have an impact. Now, I just want to talk real briefly. As we age, people tend to think that if we start having some balance issues or forgetfulness, they automatically jump to, oh Lord, they must have Alzheimer's, must have the Alzheimer's. Okay. Now, I can tell you that that's not always the case. However, a lot of healthcare professionals, not all of them, but there's some, they'll just say if you're older, well, it's got to be probably Alzheimer's, dementia, we're going to go ahead and put you on some medications and you just got to watch them real closely. And if it gets to the point it requires them to put into a home, just go ahead and prepare for that. I used to sell shunts when I was back in the medical equipment industry.
Hmm.
That's where you drain fluid from your head down to your peritoneal cavity. But one of the things that was quite common was called normal pressure hydrocephalus. What that means is the ventricles in your brain that normally filter out the excess fluid and takes it away from your brain, they can't filter it out. So they start to swell and they cause the same symptoms as Alzheimer's and
Hmm.
dementia. So if you're misdiagnosed about Alzheimer's and all you had was an issue of your ventricles not um, working properly, that means once you relieve that pressure, guess what? You don't have the balance issues, you don't have the memory
Hmm.
issues, you don't have the
Yes.
slurred speech.
Yes.
But I hate to say this, and most doctors are, on the ball, but there are some who are a little lazy.
Hmm.
So it's easier to say for an older person, they got the classic signs of
Hmm.
Alzheimer's, and let's go ahead and put them on medication. Let me tell the family members, you got to get ready because you may have to put them in a home.
Hmm.
Versus one who may do more diagnostic procedures to narrow it down and understand that it might not be
Right.
Alzheimer's. It could be something else. And unfortunately, in the
Yeah.
healthcare system, African Americans are treated differently. Not always, but statistically, it's been proven that happens based on some cognitive biases of healthcare providers. That's
Yes.
not
Yes.
fair, but that's
Yeah.
just the way it is. And I can tell
Hmm.
you personally what I have absorbed in the operating room. Like I said, when I was in there, I was invisible. I'm in the back. I got my scrubs on, got my thing.
Hmm.
I'm black. Nobody wants to look at me and talk to me. But you guess what? I got good eyes. I got good ears.
And knowledge. And knowledge
Yeah.
also.
Oh, I had to make sure I was always prepared. I got a bachelor's degree in biology, and they would test me every now and then. But anyway,
Hmm.
just keep in mind that your mental health is going to be a direct impact on your physical well-being.
Yes. And I must share with that one thing about how stigmas and old wives' tales come up, it affects you mentally, right? Like men will say, oh, I don't wear pink. And like Charlie said, oh, these are everything's pink. Who cares? Right? Who said men can't wear pink? I'll wear a pink shirt. I'll eat quiche. You know, I really will. You
I
know,
used to.
and like a stigma, that's one weird stigma. It doesn't have anything to do with men's health, but it ties into about stigmas and people believing it. You can't wear white after Labor Day.
Right.
Why?
Mm-mm.
Why? I don't get it. So what we're doing, man, in the audience out there, we're trying to eliminate stigmas. We're going to have fun while we're doing it, but we give you facts and data. We've got people on this call who have experienced life events. We got people on this call who have very knowledgeable about the healthcare industry. This is not barbershop medicine. These are real life experience with knowledgeable people. So be aware of that, you know. And if you have questions, reach out to someone. Do your research and find out credible people to talk to. Not the guy in the barber shop who's great cutting your hair, but he may not know about what happens in the OR like Bernard does.
The things I've seen in the OR, I don't want to get everybody scared, but I've been in cases where a patient came in with a bad back, left with a mid-thigh amputation. I could not believe it.
Oh no.
Oh God. I mean, I could go on and on, but I don't want to scare everybody. But and most procedures go according to plan. Every now and then mistakes are made. And it's like a blue wall of silence whenever a mistake is made.
Yes,
Everybody all of a
unfortunately.
sudden, yeah, nobody speaks up. But like I said, I got good eyes and I have good ears, and I know what I
Right.
saw and I know what was supposed to be done. But if anybody would ask me, I'm not a doctor, but I know what happened. But
You know
anyway,
what happened.
but
Right.
generally speaking, surgeons are good. And one of the questions, real quick, that I used to get when I was in the industry was,
Mhm.
"Well, Bernard, is this Doctor So and So a good surgeon?" I always give them the same response, yes. But I knew that Dr. A was all right, Dr. B was
Mhm.
so-so, and Dr. C, you better run. And you can't run because you're, 'cause
Understood.
you're, you're under
Understood.
anesthesia. But people
Hmm.
on the inside, and nurses know that too, but they can't say it. And I understand why they can't say it because they'd be blackballed and never work in healthcare again.
Yes.
So
Yes.
when
Yes.
people would ask me that question, I would say, look, one of the ways you can tell who's good at that procedure you need to have done is to find out who does the most of that procedure in a certain hospital. Now, when you ask them for that, they're going to hem and haw. No, we can't tell you that. But they do know that because if that particular doctor, male or female, is good at that procedure, they get a lot of insurance referrals. They do more of that procedure than most other doctors do. If they're not good at that procedure, they don't do many of them because they got to do revision surgeries. So guess what? They don't get insurance referrals. They don't do as
Hmm.
many of them. So when people ask me back when I was in the industry, you know, I would say, well, look, just check, and they're going to tell you right up front now. You got to keep pressing them on it. Who does the most? Like I say, and usually an appendectomy is pretty quick. I mean, you get it diagnosed, you got to have something done right away. But for a procedure that you have a little time to determine or when to get it done, if you have no other information and your particular physician who's working with you may do it once a year, I'd rather have somebody who does it 3 or 4 times a month than a person does it once a year. Not that they can't do it, and depending upon the complexity of the surgery, but that's probably the only way you and I, as consumers, can determine. Okay, it's my choice. I'm paying the bill. My insurance company's paying the bill. I want Doctor X to do my procedure.
Hmm. That's very good guidance. You know what, man? A lot of men put more emphasis in check and research the mechanic for their car
Mm.
more than they do their doctor, right? And if my car has a wreck, I can get another car. But if my body has a wreck, last time I checked, reincarnation, I don't think is true. And I know cloning isn't. So I'm going to try to take care of this body a little bit better myself.
And
And what Bernard said is very true about the number of surgeons. I did my research with my prostate cancer, and the one I had finally do it, he's the number 2 guy for our surgeries in Georgia. And so you do your homework. He was very good, not just in knowledge, but also he can translate it to a way that I can understand. And he was very personable.
that's
Charlie, you were going to say something?
I was going to just piggyback on something that Bernard and you had said, is that you were talking about a man in his car, is that if we have our car worked on, we have questions and things, we have
Hmm.
no problem asking the mechanic. If it's something we don't like, we'll stand up and advocate for it. And I want it fixed over again. But when we go to a doctor, we become like little sheep a lot of times. We don't ask questions. We
Hmm.
we sit, we take whatever the doctor says, but we have to become our own advocates.
Yes.
We
Yes.
I went to a doctor once and I asked him a simple question and he got huffy with me. That was the last time I went to him because to be is they are there to work for and with me. And if you
Yes.
not answer questions, is that then you do not need to work with me. And also, sometimes when they come in without sitting down, rush in and rush out, if we have questions, tell them, no, I have questions. Sit down, talk to.
Hmm.
In fact, I was reading, they say, write out questions before you
That's
eat
what I was going to say. Exactly right.
so that you will won't forget what you want to ask the physician. So again, men, start speaking up.
Yes. And we've got a few minutes left. And one thing I want to emphasize is this Saturday at uh, at the park in Clayton, Life What You Needed. Well, after the rain, it's Shenita has a widows group, and they're gonna have a widows walk this Saturday at starting at 7 o'clock. I want to encourage everybody to come out and show support. We're all in this together. I plan to be there. You can meet me in person and I can get your autograph. I'm nobody, so you don't need my autograph. I need your autograph for showing up to support that cause. So, gentlemen, if you can take about a minute or so and provide any last minute thought that you would give these men to take better care of their health.
Yeah, I just want to say, in the healthcare system, the nurses don't get all the credit they deserve. They do so much for patients who come in, no matter what your situation is. And in a lot of cases, I know we're talking about the doctors don't do this, don't do that, but the nurses do so much that you would not believe the stress that they're up under, not only from some patients who don't treat them with respect, but also some doctors who are very demanding. We have the choice to make to take care of our health, be there for your family, be there for those who depend on you. And the only way to do that is you have to take care of your body.
Yeah, that's right. Charlie?
I'm like a broken record. Go in, get checked up, ask questions, be your own best advocate.
Agreed. And I just want to thank you two, man. And I also want to thank Dr. Bridges because he's here in spirit. It's just technical issues in this environment world we're in. It's great. We overcome them sometimes, and sometimes we can't. But Dr. Bridges is in Baton Rouge, Louisiana. The three of us are in Metro Atlanta. But when we're on and the four of us are together, we always have a good time. We always communicate good information. And I want to thank Shenita for letting us be a part of this. Um, I want to tell you another thing about Shenita. Shenita cares about men. Her, like I mentioned about her husband, unfortunately, he died 7 years ago. But she is leaving a legacy for a lot of ways, as far as men and women. Another legacy she's leaving is your house in order. Getting your finances, your financial health together, not just your physical, not just your mental, but get your financial health in order too, man. You know, do the things that you need to do to take care of yourself because there's a saying that sometimes when people die, people cry twice. Once because they're dead, and the second time when they find out what financial mess they left them in.
Mm.
So we don't want that, man. And that's not saying you have to make tons of money. Just utilize what you have, talk to people, and just have a dialogue. You know, there's a reason I feel that women have less stress and women have less incidence of a lot of things that we have because they do get it out. It doesn't make you a weak man to talk about it to other men. It actually makes you stronger
Mhm.
because you have the courage to be vulnerable to yourself. So, thank you, gentlemen. We've got 2 minutes left. Um, I want to leave on a humorous note. If one of you have something real quick about Bernard, you probably have something funny that some man has told you about health that was totally ridiculous that he believed. If you can spend about 1 minute on that, I put you on the spot, Bernard. I put you on the spot.
uh, Nothing comes to mind right away. I, I don't. If I laughed at it, I'm just laughing. Oh, that's great. That's good. All right. Hey. But it's life is a journey. We all know that. Okay. So I'm saying, do you want to take the journey in a Rolls Royce, or do you want to take the journey in a hoopty?
Hmm.
That's your call.
All right. I appreciate that. Well, thank you, man. And thank you, Shanita. Thank you, Dr. Bridges. We're always going to have a good time, but we're going to have fun. But more importantly, we're going to get the job done. And we're going to make sure that we take care of ourselves. Say good night to everybody. Our time is up. Take care. God bless. And continue, men, always, always, always to take care of your mental, physical, and financial health. This
Amen.
has been and always will be Wendell Limitless Hollins, guest host of Life with Shenita. Thank you, men. And good night, my audience. Bye.
Night.
All right.